think a lot of people after stroke, they leave hospital and they talk about falling into a black hole, and it's really difficult for them to navigate the health system. So part of our session that we want to hold here is to look at what options are available to support people once they leave the hospital system and they've finished their rehabilitation programs, and how we can support them to live well in the community. So there are a lot of people doing research on different topics in how they can support people, and part of the work that I'm doing includes digital health support so that you can access a lot more people without having to have a lot of in-person contact. So the goals of the RECAP study was to find a way to provide support for people once they left home after the acute hospital phase. So these are people that are not offered inpatient rehab, they go straight home. Often they're in hospital for only 4 or 5 days. And so we designed a study that looked at addressing unmet needs for people once they went home and within the first 2 weeks, and giving them the opportunity to have some time at home and understand what was working for them, not working for them, what other information they might need. And then we do person-centered goal setting using a goal-setting menu. And with that goal-setting menu, we then design some goals for them that they want to work on for their recovery journey over a 12-week period. So each of the groups had the opportunity to set goals, but only the intervention group received our package, eHealth package, which was basically SMS support tailored to their areas of what they wanted to work on over a 12-week period. Now, the goal message bundles are appropriate for level of disability and also readiness for change. So a lot of work has gone into developing the evidence around that intervention package. Well, we've only just closed off the data, so I unfortunately will not be presenting the final results. We're in the process of cleaning the data and analysing the data. But what I will be talking about is the types of goals that people set. So we're providing aggregated data in my presentation this Thursday, and looking at the levels of and types of unmet needs when people first go home in the first 1 to 2 weeks, and then whether or not they change. So some of the things that we've found are that many people have goals that are unmet needs that differ by males and females. So females tend to have more unmet needs, and also by different age group, there's also a difference in whether you're older or younger than 65. But what we find is that over the 12-week period, that narrows. So men and women have similar levels of unmet needs at that 12-week period, but they still have unmet needs. So we need to think about how we provide more support for people, not only in that first 3 months, but beyond that period. A lot of people had information needs. A lot of those were addressed. A lot of people wanted to get back to driving. Many people were able to do that as well. I think there's a lot of issues around how you implement at scale these types of, when you take it from a research study into real world application. So we need to wait to see the results, but then we will be working with our collaborators and partners to think about then how you would scale up a program like that. Because it's one thing to be a researcher, it's another thing to actually provide a service, and this is a service that needs its own business case to be supported. There are some examples in other areas, like in cardiac care, where or nurse-led care or nurse models of care, where people get contacted soon after they leave hospital. But we need to think about, okay, well, who's going to pay for the SMS messages to be distributed? Who's going to, do the goal setting? Is that the role of the hospital? So it's then thinking about, well, how do you implement that within different contexts and settings?